Welcome to this Asia Global podcast, brought to you by the Asia Global Institute at the University of Hong Kong. I'm your host, Alejandro Reyes, the Institute's Director of Knowledge Dissemination. In our programs here in Hong Kong and online, and in the content that we produce, we focus on presenting Asian perspectives on global issues. This podcast is part of our Meet the Author series, where we have a conversation with contributors to Asia Global Online and other publications of the Institute. Joining me now from Delhi, India, is Preeti Singh. Preeti is a journalist, editor, and communication specialist based in India. She has worked as a senior advisor at 9.9 Insights, an independent strategic advisor of the Washington, D.C.-based Albright Stonebridge Group, as a journalist in both print and digital media, and as a business editor and researcher. She has 2 decades of experience at the Institute for Defense Studies and Analyses, a premier national defense and security think tank, as part of the op-ed team at the Hindustan Times, India's leading news media house, and as an editor in integrated media companies 9.9 Media and BW Business World. She holds a master's degree in Indian history and an MPhil in disarmament studies, and was a Chevening Gurukul Scholar at the London School of Economics and Political Science, the British government's flagship leadership program for young Indian achievers. She edits nonfiction books and teaches business writing and communications in various management programs. So Preeti, really welcome. Thank you for joining us.
Thank you so much for having me on this, Alejandro. It's great to be here.
Great. Now, your article, which continues to trend on Asia Global Online, is really a personal reflection on the COVID-19 crisis in India. You argue that the complacency and heedless behavior of well-educated Indians in response to the pandemic led to the perilous and desperate situation the country had been in, and now things have subsided somewhat. But it's really a very stirring, evocative reflection, and I commend your article really to our listeners. I'm wondering if you could sort of update us on where the situation is, because if you look at the numbers now, it looks like India has come down from the ramping up where it was in sort of mid-April, and now has come back down in 2 months, back down to that level where it was in mid-April.
So interestingly, Alejandro, in fact, the day that we posted the article, that was the day, I think, if I recall correctly, that for the first time in India, we crossed 4,000 daily deaths that particular day. And it was 400,000 cases, I think, if I'm not mistaken, which we had also crossed. I mean, there was a landmark at that time. And fortunately, I mean, if we are to believe the numbers that are coming out from the government now, it also seems that we are talking today after another landmark has been achieved, because for the first time, cases have fallen to a 2-month low. The positive cases in India, yesterday's figures by the health ministry also say that the cases have fallen to a 2-month low. And it seems that the positivity rates have declined as well, and based on all the testing figures that the government has. And so here we are talking on a day that it seems that yet another and a more fortunate landmark perhaps, or a better landmark, so to speak, has been achieved. And yes, I wrote this at a time when things were pretty bad in India, and it was obvious for everyone to see, because it wasn't only the news outlets, or it wasn't only the news that was reaching people, but it was personal experiences of all of us who were at home, who were receiving calls about people we knew struggling to find a hospital bed, struggling to find oxygen, ICU beds, oxygen concentrators for family and friends. And for the first time, it seemed, and in fact, a lot of that article was written. I have to tell you this, that I wrote that just sitting on and typing on my phone. I suddenly felt such an urge to actually express myself that I just wrote most of the article in minutes on my phone, because the general air of despair that was surrounding us at that time, it was written. So I would like to add that it was written at a time like that. And definitely, we've been through some very tough times in the past few months, and something that no one had anticipated after what happened at the end of last year, how cases have declined.
Well, I think it comes through that, you had a lot of, you were impassioned, if you will, but of course, that that's always the inspiration, these kinds of events of all the best, most evocative writing. Um, I'm interested very much in the theme that you have, though, because you focus very much on the divides in India, and really about those who are educated, those who might not be, the haves, the have-nots, and the complacency that settled in the early stages of the pandemic, when it seemed like India was handling it pretty well. You even mentioned in Diwali last year that there was a lot of freedom going on, and people were roaming around. And indeed, you even mentioned the cricket was taking place, and nothing can stop the cricket from taking place in India. Um, uh, Tell us a bit more about that, and your evolved feelings now about this divide, because it's not only an Indian problem, of course, and we see this in many other countries around the world, in the United States, in developed countries, in developing economies, that to refer to Andrew Cuomo, the governor of New York, who said that the pandemic is like a big giant wave that has come and receded, and it exposes what's kind of under the surface that we may not have noticed when the high tide is in. And in some ways, this is what you're trying to point out, that the tide came off during the pandemic, and it exposed some faults in Indian society that you were really lamenting.
So Alejandro, I mean, as you very rightly mentioned, that these fault lines exist everywhere. I mean, it could be race, it could be caste, it could be economics, pure simple economics. It's that the same kind of divides exist in India as well. I think one of the things that people, I'll just turn this on its head a little bit. One of the things that people, I think, forgot was that something this big and something this indiscriminate is a great leveler, because I think that was one of the biggest shocks of earlier this year, of April this year, because till tests were easily available in India, people who could afford them, for example, labs were charging um, a hefty amount for tests if they were coming to your home and doing those tests. A lot of people could not afford that. A lot of us who, I have to mention here that because I had been sick 2 years ago, I have been under very strict quarantine. So I also must add this as a caveat, that I've been watching a lot of this from the safety of my own home, not being allowed to go out, not being allowed to travel, not allowed the vaccine, and all of those things. So I've been watching it from far, and you realize that um, everything that you were reading, not just in the news, but everything that you were reading, India is big on WhatsApp. And there is so much information and misinformation that is spread from a medium, any medium like that, any chat medium, that you were also being a spectator to the kind of debates that were going on within your friend circles, within circles inside your family, within, say, even our classmates were discussing things like this. So there was a lot of churning, and there was a lot of, in the beginning, there was this division: people who could afford the care in private hospitals, people who could afford the tests that cost more than sometimes what people make in a month. And it was difficult for people to actually get those tests done because so that was one thing, of course. And the other also has been in terms of information. And I must mention that though in the beginning India seemed very gung-ho, we had our prime minister break his 5 year silence, so to speak, because the most interesting thing I find about this term for Prime Minister Modi is also that the pandemic has actually made him also come out and address the nation more times in a month. In fact, more times, sorry, over these past few months. And he had not done a single press conference in all his years in office in the first term, and he rarely addressed the nation, except when, of course, there were, there were incidents or there were announcements like the demonetization or the surgical strikes on Pakistan. Except for things like this, he had not really addressed the nation and he had not been seen so much. That changed. And in the beginning, I think that gave a lot of people hope. It gave a lot of people, all of last year, when the government was actually coming out and saying that, hey, this is a tough time. This is something that we'll all have to handle together. And then when the cases started falling, when, of course, India, as everyone says, that India handled the first wave better. I have a slightly different take on it. I also feel that we were lucky in a lot of ways because, yes, there were certain steps taken that kind of stemmed the tide for a while for us. And we watched, from a distance how even the best healthcare systems in the world struggled. And for a minute, we were happy patting ourselves on the back, saying that, we've handled this pandemic well. And then the complacency set in. And I think that complacency went both ways. It went from the bottom up and again from the top down. And I think that is what happened, which turned the tide really in April this year. Because by the time 2020 came to a close, we were doing much better. Personally, I mean, I like to say this, that I probably have been in this almost like a jail situation, not being allowed to go out. Personally, I was allowed to go out at the end of 2020. So you saw people in bars, you saw people in coffee shops taking slight precautions, but then suddenly it was as if everything was back to normal again. You did hear murmurs. And I think that is where that another divide came in. The people who were actually still worried, people who were seeing what was happening in other countries, people who were studying the pandemic, people, doctors who were seeing the kind of cases that were coming to them. Very few people who were, say, writing or warning on Twitter or on certain groups or on Facebook. But again, that is where the digital divide in India comes in. That the information that was coming on digital media and the information that was coming on, say, a Twitter or a Facebook, or people who were sharing these articles, is not something that the rest of India had access to. And from the government, we were also getting, we were too quick to actually claim victory over COVID. That is what I'd like to say. That I think that happened at all levels. And you can't only blame a certain party, a government, or a group of people. This is what I argue, that every one of us actually must share the blame for what happened in April.
Well, indeed, in your article, you said, I'm quoting it directly, as for the politics, the performance of most political parties bordered on tragicomedy. Do as I do, not as I say. Karma-loving India should have known better, is the way you put it. And I think it's very interesting. Do you think that then the politics has changed as a result? I mean, you said Prime Minister Modi now has been speaking to the nation, or spoke to the nation more often. Has this changed the way politics is going to operate going forward, or do you already see some kind of returning to the way it was now that things have sort of calmed down a bit?
I think it's been a bit of both. I wouldn't say politics has changed, because politics in India, as they say, the more things change, the more they remain the same. That's how it happens here. And I would say that a lot of it has gone back to being what it was, business as usual. because you also have to remember that we had state elections, very, very key and crucial state elections, for which, again, when I say that everyone must share the blame, and when I say that there were indications from the top down, which was when you have popular political leaders, leaders who lead not just parties but states or lead public opinion, when you have them coming out in the open without masks, when you have them sitting on stages with no social distancing and conducting rallies which have thousands of people without masks, packed like sardines, that, and then you realize that just looking at that would sometimes put the fear of God in me, honestly, to be very honest, because you just had people attending rallies and you had people in such closed groups that it was very difficult to imagine that the virus would not spread the way that it did. And I think that it wasn't even a lack of imagination. I do say that there was a collective lack of imagination. I don't think it was that. I think it was the callousness as well. It was putting politics above health. It was putting politics above, popular welfare, rather. Populism over popular welfare, I would say that, in a lot of ways. Because that was a time when, you had everyone just focusing on the numbers game, when the elections were due. And I think that the second thing I'd say is that you can't only blame the politicians, or you can't only blame the people who didn't know better, or the uneducated, because the way that I argue, our educated India behaved. A lot of people, you mentioned the cricket, and I also mentioned it, that in India, the cricket and as well as all your religious festivals are the two things that go on no matter what. And a spike happened after Diwali, a slight spike, because a lot of people thought that things were fine. And then another spike happened after the big festival of Holi, which we had in March. And you saw crowds just gathering at the Kumbh festival. You saw crowds gathering at election rallies, cricket matches, people who should have known better, who were educated, who were reading the news from other countries, who were reading the research that was coming out. And I think that is where I feel the political failure really lies, in not setting that right example, by not leading by example. And we're at very small incidents. I mean, it's not even to look at policy, or it's not even to look at an overarching kind of, change, but it's to look at the little behaviors, or the little, those key moments which could have been game changers. Imagine if all the leaders sitting on a dais had sat 1.5 meters or 2 meters apart and worn a mask. People who are very well known, they don't need to broadcast their faces. So I think that is where I feel that politics won every time.
Now, I'm going to take a slight tangent, because you talked about digital divide in India. And I've been actually looking at this situation because, of course, all over the world, a lot of work, particularly education, schoolwork, to migrate online. And how did this work in India? Because if there is, when you have a digital divide, then clearly at a time when education necessarily has to be online, then the have-nots are even more severely disadvantaged. And already you had severe education challenges in India. How did this work out from your perspective?
So I must mention here that when I do talk about the digital divide, I should clarify a little bit that it's also the English versus the vernacular sometimes, because a lot of information that was coming out, the way that we see it, that a lot of information that's coming out, research that's coming out, um, it's a lot of it is in the English speaking or the Hindi media. Vernacular press, of course, does its job. In India, we have a very robust vernacular press as well. But the point being that when I talk about the digital divide, I also must mention that over the past few years, I've personally seen how things have become much better. Definitely, there still exists that difference in access. For example, if you don't have good broadband connections, if you don't have electricity to charge your phones, you don't have affordable laptops, or you don't have places where you can actually plug in, so to speak, in every which way, that has definitely changed for the better. I would say that over the past few years, this under the entire Digital India program, as well as the fact that people themselves have become more digitally active, they have demanded more access. And the new generation that is looking at things like Facebook, at Instagram, not so much Twitter, I would say, but Instagram has been quite a game changer as well in terms of a lot of young people going online. And then, of course, you have YouTube, you have WhatsApp, which also became a broadcast medium for a lot of people. And so when I talk about the digital divide, I say that there is definitely still a lot to be done, but things have become better. Now, here, Alejandro, I'd like to mention a huge positive change I think that we'll see after the pandemic, because uh, a lot of work that the government had been trying to do for the past few years, and not just this government, but the previous government as well, was to try and get more people online. This government, of course, did it because they were digitally much more savvy. I have to say this. Their campaigns were run better. The digital reach of the BJP and the digital footprint of the BJP has always been stronger than its opponents, because they got on to that much faster than the rest of the parties in India, the political parties in India. They ran campaigns digitally way before the other political parties had figured out how to. So there has been digitalization, there has been more access provided under this government, but the point being that if you don't have the wherewithal, for example, unless you connect all your schools in a way that it is easy for teachers to actually broadcast lessons, or you actually have, school networks that are online, libraries that are online, access to resources for students in different languages, all of these are works in progress. But I feel that the we will actually, just like India leapfrogged during the telecom revolution, I feel that the biggest positive impact will be, of course, on education. It's been tough for students this year. We've had, I don't know if you've read the news on this, we've had our board exams cancelled for class 12 students, leaving a lot of parents wondering how college admissions will work. On a lighter note, a lot of students have missed out on the joy of graduation, on the joy of farewell parties, and I think that has been a big hit. But at the same time, I feel that um, taking education and work online, the way that we have, in whatever limited capacities that we have, will help us leapfrog to the next level when it comes to online education. Definitely, even if it's out of necessity this time, rather than really, yeah.
I think that's a very good way of looking at it. It's the kind of that make do innovation, right? That
Absolutely.
a part of Indian creativity that people talk about. You already touched on it, and as a media specialist, let me ask you a bit about the media coverage of the crisis period, the previous 2 months. When you look at the numbers, the and say compare India to the United States, the right now the 7-day average in India of cases is 120,000 cases a day, which is tremendous. But when you look at per million, which in many ways is kind of a more important way when you're comparing with other countries, India has about when I looked earlier today, 256 deaths per million and 21,157 cases per million. But compare that to the United States, which is 1,820 deaths per million, which is significantly higher than the Indian number, and 101,700 cases per million. So whilst India was getting so much coverage for this horrible crisis, was described as a sort of unprecedented and tragic, in United States was coming out, and there was a great sense of positivism there. So in some ways there was a kind of asymmetry that was rather jarring, because at the end of the day, the United States numbers still are and still were worse than India's. And so what are your thoughts on and I know there's sort of different perspectives here. There's the international coverage that was received, and also the domestic media. What are your thoughts on the media coverage and the responsibilities that the media either fulfilled or did not fulfill?
So I must enter a caveat here first that for the past couple of years, somehow I have kind of isolated myself from a lot of the television news because, and here I think I probably would be saying something horrible against my tribe, my very well loved tribe. I love them. I loved always being
I
a
used
part
to
of
be a
media.
journalist, so I've gone there already. So
So I have to say this that so much noise sometimes that I stopped actually watching television news. So it would be unfair of me to really comment too much on it. But yes, as I said, being a bystander, being a spectator to a lot of it, as many of us were, I mean, I feel that a lot of there was hysteria created at times when it should have been toned down. I'll tell you why this became crucial later on. What was happening was we were getting news, for example. I mean, it's not to say that you don't cover things like this, but we would every day on our phones we would get news like, a man dies outside a hospital begging for oxygen, touching the feet of a doctor. And while these cases break your heart, you think about it and they break your heart, you have to sometimes also look at the larger picture. What this did was actually caused a kind of panic that led to a bigger healthcare crisis, in my opinion. Because I was talking to doctors. I have a lot of doctor friends, both in India, and I have a couple of doctor friends in the US as well. And my friends in the US were actually surprised at how we are not practicing what they call evidence based medicine. That the fact that a lot of these drugs, which are prescribed only at certain stages of severity, were being bought over the counter. And as a result of panic buying, we were actually in a situation that people who needed those drugs were not being able to get them. So I feel somewhere here, the media and, as I said again, educated Indians must share the blame for the kind of crisis that it just kind of catalyzed it into a worse crisis. And I think that is where somewhere that when I keep talking about education, when I keep talking about people who know better, that we should have known better to actually lead better. Because I remember my brother, my sister-in-law, my sister, they all got COVID. And once they tested positive, how difficult it was for them to actually get the medicines that were prescribed, because they had, my brother and sister-in-law had very severe cases, very high fever. The children got it. How difficult it was to get a medicine that was easily available just a couple of months ago. And I think a lot of that was because of the panic and the hysteria that was being caused. Videos surfacing of saying that this medicine or this steroid is a miracle drug, or people on groups. It was, for a while it was difficult to actually go and access your WhatsApp, because all you saw were people saying, does anyone know where to get this injection? Does anyone know where to get this medicine? There were resources being shared all across. People were sharing both verified and unverifiable resources. I had calls because, when you're in a small town, sometimes access is a little better, because Delhi was in a terrible state at one point. We had a tremendous crisis in Delhi. Also because, and also Alejandro, I have to mention here that, when you talk about India, everything is on a huge scale because of our population. So
right.
I think whenever we talk about numbers, I think of it less like a person who looks at numbers or who looks at, I look at it more as a student of humanities, and I think about this as a larger problem. A large population which is actually the is and the health and a healthcare system which is unable to handle the disease burden of something like this. I think that in itself was a crisis in the making. It has been for a very long time.
Right.
So, which was only multiplied by the kind of hysteria that was being generated. I feel that a little more responsibility is the order of the day, should be the order of the day going forward in any case, COVID or no COVID. I think for a very long time, I feel that certain sections and parts of the Indian media have not done justice to the profession. Indian media has always been outspoken. I have been a part of it, I must say only in print, but I've met immensely brave, immensely balanced journalists in my life, and I've met the other kind as well. So I feel that it's important for the brave and the balanced to really take more control of what is happening in the Indian media. And as far as international media, sorry.
No, no, go ahead, please.
And as far as the international media is concerned, I mean, it was easy for us to actually find scapegoats. Someone sitting outside reporting on the country has always been, that there is always this touchiness that happens when things are when things are bad. And that would happen anywhere. And that is what happened. And we found an easy scapegoat to say, oh, you know what? The international media, look at the Guardian's headlines, or look at, NYT or Washington Post, or look at them, look at the headlines. And the Australian, for example, there was a headline in the Australian that the government took severe objection to. And I think we just found it easy to blame someone at that time. If we were either blaming the government, we were blaming the international media, we were blaming the media for hysteria. And as I argue in my article, without really turning inward and realizing that a lot of it was also something that we didn't anticipate and we didn't handle well.
I think it's interesting because what you say about domestic media, and indeed also about international media, it could well apply to the situation in the United States too. And not just in terms of COVID-19, but also say, when during the Trump administration, just coverage of the Trump administration, coverage of January 6th, the invasion of Capitol Hill, that they, I mean, not to detract from the seriousness of the issues, but certainly there was a lot of, in some ways, media mishandling or not proper handling, as well as very good reporting. But but in this digital age, as you well know, it's hard to get it right nowadays, I think, because of the very fast pace. Preeti, I'm wondering if you could just reflect more broadly. What are the lessons then that you think Indian people, Indian society should take from this pandemic experience? Now, God willing, now that things have subsided somewhat, that trend continues and there's not another big spike. What are some of the lessons that you think should take place or should be learned at this point? And do you think they could be learned?
I think something like this, I hope at least. I'm an eternal optimist, Alejandro. I have to say that my optimism is what I feel sometimes that makes me not on the side of caution, but on the other side. But I have to say this, that definitely, I mean, going forward, there are certain things, as I mentioned, that by per force, due to necessity, things that will change. And like, for example, as I said, that the entire nature of work has changed, and not just for one country or one corporation or one industry or one vertical, but the way we work now has changed. And how people who were reluctant to actually work, companies either who were reluctant to allow employees to work from home, or people themselves who were reluctant to actually work digitally have been left with no choice. And I think that is where when I talk about the leapfrogging that has happened for each one of us, whether be an individual or an organization, I think that has been one. And the other thing, definitely, the first and the most important thing that comes to mind is our healthcare system, our public healthcare. Because I think what this pandemic has shown us is the abject failure of our public healthcare system to handle something of such proportions. And I think so that is one of the first things that we need to address. And this has to be this has to be done together. When I mentioned that, I've met the brave and the balanced, and I've met the other kind. The problem usually is that the voices of reason are often drowned out by a lot of the din when you have so much going on. Like in every country, whether it's politics or it's religion or it's sport or it's 100 other things that are happening around us. We often lose those sane voices in that din. And I think that is something, it's contingent upon those sane voices, I would feel, that for them to also speak a little louder. That is one change that we need, definitely, because we've been talking about it, and it hasn't happened as much as it should. The public healthcare system definitely needs a complete overhaul. I remember writing for the Hindustan Times. I think this must have been in 2006 when I was in my first stint at HT. We had done an entire page, and that's a huge thing, an ad-free page, a full page on, we used to do this every fortnight. And we had done one on assessing the public healthcare and looking at whether the Indian public healthcare system would be able to handle the burden of a global pandemic, or would be able to handle the burden of, say, a severe outbreak of any kind of disease in the country. And when you look at the number of doctors per 1,000, per 10,000, you look at those numbers and you compare them with some of the better healthcare systems in the world, I mean, we fail abysmally. And also to look at the number of beds, hospitals, I think we need to prioritize. India has, of course, I mean, I always say that we are always building. If you travel to any Indian city, the journey from the airport to the city, you will realize that India is a nation constantly under construction.
Right.
I feel that a little bit of focus. I mean, we've done the roads and we're overhauling the ports and the flyovers and the cities, but we're not looking at one of the most crucial aspects of well-being in our country, which is the public healthcare system. And I think that needs an overhaul, because not everyone, as we've seen, can afford. And the other great thing, I mean, actually, wrong choice of words, not great, but the other thing that happened, as I said earlier, was that this pandemic has been a great leveler. And I hope that will make people realize that there was a time, Alejandro, when we were hearing news from Delhi that no amount of money could get you an oxygen cylinder or a bed in a private hospital, because physically and in terms of just being present, it was impossible. There were no beds. There was no oxygen to be had, no matter what you tried. I mean, you heard, and how the way that the discourse also sometimes runs in India, how people would say, oh, did you know that so-and-so is a civil services officer and his family didn't get a bed for 3 days, his family. Now, suddenly there's a big panic. There is this paranoia that, oh, the civil servants who are supposed to be in India, the ones who can actually either get you access or who themselves have access to the best. Suddenly, when news like this comes out, then people start realizing that this is something that actually, and I have to say this, I used to go out. I've been staying in a small town with my parents, and I used to go out to get groceries, in which, you would just get groceries in the back of your car. People in a small town, you could call them up, they would just pack the groceries and you could pay digitally. I noticed the change in the number of people wearing masks suddenly, almost as if overnight. Because when the realization set in that no amount of connections, political, administrative, medical, or healthcare connections could get you a bed, or could not get you oxygen. Suddenly, we shouldn't have waited for that situation to arise. And I think that is something that I hope will change, knowing that um, we need to do more of our bit for a greater kind of equality in this country, for access.
It's interesting because, of course, the immediate priority for India, as for many countries in this pandemic right now, is the vaccine rollout, and that's a really a public health priority. How is it happening in India? The last time I looked at the number, it was I think 3 to 4% so far of the population has been fully vaccinated.
So one thing, just recently, the Delhi Chief Minister, for example, announced that they will be using the infrastructure. So India, when the general election happens, it's the largest exercise in the world. The kind of planning and infrastructure and personnel deployment that goes into an Indian election. I think it's a very interesting idea that the Delhi Chief Minister has had to use polling booths as vaccine centers, because people are already registered at those polling booths. You already have voter lists. You already have mechanisms to track who has got, who has voted or not. And I think I feel that's actually an interesting idea, looking at what already exists. Because the first impulse is to build something new. I think the question, we used to always talk about this when we talked about, when we talked about defense procurement, or we talked about security issues, that there is this constant urge to reinvent the wheel. Why? We already have so much in place that we should be leveraging at this time. For example, the Aadhaar cards. I have to say this, that there has been, of course, a lot of debate on privacy in the country. I won't touch upon that because that's a whole other hour, privacy and data and all of that. That's a separate thing altogether. But I think in tracking numbers, the fact that even the smallest labs made it mandatory for you to show your Aadhaar card and to give your Aadhaar card as proof of you getting a test done,
Right.
and later also as vaccines, it's been, I would say, better to track the numbers, because I don't think we would have been able to track numbers if we hadn't had a mechanism like this. So similarly, for the vaccine as well, I feel that we need to use the kind of resources we already have in place. And you're right, you rightly said that it is a public health issue as well, because there is the question of availability. There is the question of, for example, people have even mentioned that just yesterday, Mr. Gandhi mentioned that, why should private hospitals be even charging for vaccines? So there is the affordability issue, because if people can't get a slot, say, at a public health center, and if then they must pay a slight premium to actually get vaccinated at a private hospital. The government has allowed each private hospital now in the latest policy to charge about $2 over and above the vaccine cost. And I think so, all of this, the availability, the affordability, the distribution. Now, there has been a lot of, there's been a kind of, what should we say, like a tug of war. There's been a lot of back and forth between the state governments and the center. Health in India is a state issue. It comes under the constitution in the state list. Health comes under the state list. So a lot of the policies that are then made on public health, or the way things are handled, are the purview of the state governments. What has happened now, that after everything of the last few months, the center has again decided, Mr. Modi in his address to the nation yesterday said that the center is kind of taking back control of vaccinations and also bearing the cost for the states. Because earlier it was the states had to bear a certain amount, a part of the cost for the vaccines. Now the center has decided to take that on. Again, what has happened, I feel here again, there is, it's been decided that the sort of like a quota for the vaccines, 25% is still allotted to private hospitals. 75% is then for your public healthcare system. But if you look at the numbers, and I mean, I'm afraid that I don't have the numbers ready, but if you look at the fact that most of India is not able to access private healthcare. Then some people are also talking about why the allotment of 25% to private hospitals and then allowing them to charge a premium. So I think all of these debates, there is a lot of churning that is going on. You find people on both sides of the divide. You find also that this constant tug of war between the states and the center. There has been a lot of back and forth in terms of our vaccine policy, because as a result of this, states wanted more control. They took more control. The center now decides that, states are not handling it well. Maybe it's better. Some states, of course, which are specifically BJP ruled, it's easy for them to actually say it's all right. Other states are still opposing it. So there is a lot of the vaccine politics also that is going on, if I may call it that, and that there is going to be a lot of churning. But I think the priority at the end of the day is to ensure that every Indian gets vaccinated, because now you're looking at other countries starting trials for children. And here we are not even being able to vaccinate people in the more vulnerable groups. And I think that needs to be addressed.
Now you called yourself an optimist. So where are you? What do you think now, looking forward in terms of the pandemic, kind of how it will work out? We already see countries opening up, reopening. Um, Issues of quarantine and travel still have to be sorted out. But what's your view of where India is heading on this at this point? At least, what's the vibe at the moment?
So again, I mean, if you look at slowly, a lot of states now, actually here again, there is a slight difference in uh, between states. So there are certain states that are worst hit at this moment, who are actually tightening controls. There are states in the south like Karnataka, Kerala, which are tightening controls because they still have cases on the rise. And then you have a couple of states which were actually the worst affected. When you look at Maharashtra, you look at Mumbai, the numbers at one point, in fact, again, when I say that we should have seen and learned from what was happening in our own backyard, how bad it was in Mumbai at one point, and how everyone else didn't realize that this was something that was going to happen in other states as well. But now you have, of course, states like Mumbai, which are very badly hit, slowly opening up. Mumbai hasn't opened its rail network yet, the metro rail, but the local trains, but it has started bus services. Delhi has opened up the metro. Apparently, over about 400,000 people traveled by the metro yesterday, I think. And Delhi has opened up 50% capacity, the metro trains. You're also seeing states allowing bars and salons to open. Now, I have to say this, Alejandro, that beyond a point, I think we will have to open up. And states, you look at the economic impact of something like this as well. People losing their jobs, people being forced to shut down. I mean, just as an aside, I'd say that yesterday I was reading the news that in Mumbai, the Hyatt's Regency Hotel has decided to shut its doors because they cannot afford to stay open anymore. And then when you look at the number of livelihoods and jobs, that are affected by one decision like this, then you look at the kind of impact on the rest of the economy. So I would say that yes, we will have to open up. We don't have any other choice. Then it becomes even more important for every person to actually bear the burden of that decision, because then the responsibility again shifts to those who are in favor of opening up, who are in favor of traveling by public transport, who think that we should open up more. And I think absolutely going forward, we will have to open, we will have to find different ways to do things. We will have to find a middle path, so as to speak, to say that what is our responsibility going forward, both of the state to its citizens and vice versa. So I think that is what I'm hoping will be a more positive impact. As I said, I'm an optimist. I often keep hearing, oh, nothing is going to change in this country. I refuse to believe that. I've seen a lot of change. And I have to say this, that I'm very proud of a lot of the innovation that goes on in this country. I'm extremely proud of the way that, people come together. It took a pandemic and it took something so sinister at the end to really get um, people suddenly, to just kind of regenerate, to reactivate everyone. If you saw the way that not just individuals but corporations responded to the oxygen crisis and the amount of money that was raised, the amount that both the private sector as well as small organizations and individuals, the kind of work that they did, I have a lot of hope. I always feel that there is always hope to just do better and better. We will have missteps, every country does, but I'm hoping that this will take us further than we've been before.
Preeti Singh, thank you so much. You've been very generous with your time. It's been very insightful, and thank you very much for being so candid and open. I commend to our listeners Preeti's article on, and her reflection, her personal reflection on the COVID crisis in India. It's trending on Asia Global Online. Please come to Asia Global Online website and sign up to receive our information and emails. Asia Global Institute website, you can do the same. And follow us on Facebook, LinkedIn, Twitter, and YouTube. Preeti, thank you so much again. You've been very generous and it's wonderful to see you.
Thank you so much, Alejandro. It's been great talking to you. And it's great to actually find a medium to talk about things other than just the sheer numbers and the statistics that we see every day.